So self-harm means different things to different people. So some people think about attempted suicide, other people talk about non-suicidal self-injury. What we tend to do in the UK is consider them together. And self-harm we define as self-injury or self-poisoning irrespective of apparent motivation or intent. Why do we consider them together? That's because actually when people are in crisis, it's really sometimes very difficult to see what the intent is, what the precise motivation is, and the motivation may change. And the other reason is when we follow people up, even if they've made what apparently are low seriousness attempts, you follow them up and they have poor outcomes. So that's why we consider the kind of self-harm group together. Sometimes when you talk about self-harm, people think that you mean just self-cutting. And self-cutting certainly is an important part of self-harm. But in hospital settings, it's actually self-poisoning or overdose that's the commonest method. So that occurs in about 80% of people presenting to a hospital. But self-harm also includes other things. It can include burning, scratching, and biting. So one of the other things to say about self-harm is it's common. It's one of the commonest reasons for admission to a general hospital, and it's often repeated. So about 1 in 5 people who come to hospital with self-harm will repeat within a 12-month period. And unfortunately, it's also linked to a risk of suicide. So in the year after someone presenting to your hospital, to your emergency department with self-harm, they might be at 30 to 100 times greater risk of suicide than people in the general population. And you can express that in another way as well, in terms of years of life lost. So on average, people who self-harm might lose between 20 to 30 years of life expectancy. So it's a serious problem that can be associated with quite poor outcomes. And the other thing just to emphasise is that self-harm is a behaviour. It's a behaviour, not a diagnosis. So it's not a psychiatric diagnosis, and it's a behaviour with a wide variety of underlying causes. So things like mental health issues, life circumstances, drugs and alcohol, all those things can contribute to self-harm.